We were dependent on the webinars to fill that sales funnel, but now with the different advertising campaigns we're doing through y'all, the funnel has never been bigger.
Last month alone, we generated over 200 plus leads. How did that level of volume and cost compare to what you had seen before working with us?
Oh, I mean, it's really not even a fair comparison.
What was the first thing that happened that made you feel like, okay, these guys were different?
While y'all are figuring out what's working best, y'all will be quick to pivot, to change strategy as needed.
Did our understanding of the health space make a difference?
Y'all seem to figure that out, that Google wasn't effective, and y'all switched and pivoted to Meta.
So let's get started, Jonathan. Tell me a little bit about yourself and what you're building with Dr. Well.
Yeah, I'm Jonathan Kaplan. I'm a board-certified plastic surgeon based in San Francisco, and I started a company called Dr. Well. There's a lot of background, but we started in price transparency, e-commerce, price transparency in healthcare, e-commerce in healthcare. Now we are offering weight and wellness platform, a bolt-on platform for healthcare providers to an existing provider's practice. They don't have to figure it all out on their own.
Beautiful. And then, Jonathan, before we started working together, what was the biggest challenge you guys were facing?
Well, when it came to marketing, it was very clear what the problem was or what the issue was. But even though, and even though we could identify the problem, it wasn't as easy to fix it. So when we are trying to get more providers to use our platforms, it was very frustrating through our previous companies. Google wasn't getting to the people we wanted. LinkedIn didn't get to anybody. And so what we found with success with y'all was that y'all also maybe didn't find that Google was that effective. So y'all pivoted to Meta, and Meta has been much more effective. I guess Meta's got more information on the people that they're reaching out to. They know that they're an actual provider. They know they're not a patient. So we've had a lot more success with y'all on Meta. And I think the other thing that's been effective with y'all is that we were able to provide y'all with an email list of our existing providers so that y'all are able to create campaigns with lookalikes. I think that might be the secret sauce, is it's the lookalikes. So, and as we get more providers on our platform, right now we have over 200 providers, so we got a lot of data there. So as we can upload and utilize even more than more people in that lookalike list, 200 plus, getting to 300 plus, that'll make our marketing even more effective.
Perfect. And Jonathan, like, I think you told me you had worked with other agencies before. Like, what was the thing they weren't able to figure out that we figured out?
They figured out that they did not figure out that Google was not effective at differentiating between providers and patients looking to start a weight management program. Y'all seem to figure that out, that Google wasn't effective, and y'all switched and pivoted to Meta. And then in the combination with the lookalike list that we provided you, y'all were able to get us a lot more leads. I mean, it's really been a stark contrast between other companies and now. And even when y'all were optimizing in the first few weeks or the first month or two, to now, or 3 months in, we're getting significantly more leads into our funnel, and they are providers. They are the people we're looking for. That's not patients. It's providers in various stages of their practice. And we do ask those questions once we get them in our funnel and get them to our lead form. We find out, are you just starting? What do you already have an existing weight and wellness program? So we ask a few questions to get a little insight before the actual demo. But there's no question now there's been this significant spike in leads, providers that we're getting into our demo, and then obviously it's up to us to close them. But we're certainly filling up our funnel like never before. And if I was going to say it was two things that y'all have helped us with, it is pivoting to Meta and using a lookalike list to find similar type providers out there in the metaverse.
Yeah. And there's a bunch more things that are still left to do once we hone in on the ICP, Jonathan. Let me ask you this. When we first launched the campaigns, what was the first thing that happened that made you feel like, okay, these guys are different. They can make this happen?
I think it's that y'all didn't waste a lot of money or time on Google. Y'all gave it a shot. That was obviously a natural thing to do. You gave it a shot. And I was pleased with how quickly y'all made the decision to pivot over to Meta to see if we would have more success there. And thankfully we did.
Last month alone, we generated over 200 plus leads, like with the compliance lead magnet that we have, and also booking demos from our campaigns. How did that level of volume and cost compare to what you had seen before working with us and with other agencies?
Oh, I mean, it's really not even a fair comparison. I mean, it went from, you're saying 200 plus leads in a month, which is what I can vouch for those numbers. I mean, before that, we were talking about maybe 15 to 20 leads in a month beforehand. And I'm talking about 15 to 20 provider leads. There were more leads than that that these other companies were getting for us, but they were patients. They were like clearly not our ICP.
Wrong ICP. Yeah, that makes sense. And did our understanding of the health space, obviously, you know the space the best, but did our understanding of the health space make a difference? Like looking at landing pages, audits, creatives, funnels, compliance, lead magnets, things along this note?
Yeah, I definitely think that y'all's knowledge of that helped, and that's actually one of the reasons we picked y'all because y'all had already had some experience with telehealth marketing, even though we aren't DTC. Exactly, that y'all at least were just familiar with the terminology and, the difference between a PA and a nurse practitioner because we have a medical director program that we're, working with y'all on. Um, but no, y'all's just having I mean, there's other international agencies that we talk to, um, but, advertising for healthcare services in the UK is not the same as, advertising healthcare services in the US. During our interview process, when we were meeting with multiple agencies, that is the reason we picked y'all is because y'all had more healthcare experience in the US specifically.
Are we the only agency that's been able to deliver this combination of lead volume and cost efficiency for you?
Most definitely. And we've tried, I'd say we tried 2 to 3 other companies, and, they were not able to deliver on getting us that ICP. There's no question we've seen the difference.
That's awesome. That's good to hear. And how has having now this consistent lead volume done for your team internally?
Oh, it's definitely raised morale because the funnel is bigger than ever before. Because we also do separate from y'all, we do webinars, and we get a lot of leads from webinars, and so we were dependent on the webinars to fill that sales funnel, but now with, the different advertising campaigns we're doing through y'all, the funnel has never been bigger. So now it's really incumbent upon our sales team. Also with the release of some new pricing tiers, lowering the barriers to entry, there's no excuses anymore. We've got the leads of the ICP, we've got better, price points for different providers to enter into our platform, and so it's really up to our sales team to close those deals, but it's definitely raised morale then in the sense that getting so many leads now.
If another health founder was on the fence about working with us, what would you tell them?
I would tell them that y'all do your research in that first few weeks to a month or so to get an idea of what is going to be most effective and to be patient. They should be patient with any marketing agency, but they would be well served to be patient with y'all because while y'all are figuring out what's working best, y'all will be quick to pivot, to change strategy as needed to get the results coming in that they're looking for.
Great, great to hear. And what makes our agency different from other agencies you work with?
I think that rather than, let's say you sign up for an agency for a 6-month commitment. I think that rather than the agency waiting for 5 months to find out what needs to work and then pivoting right before the renewal date to try and get you more leads, y'all were making that effort early on. Within the first and second month, y'all were evaluating and pivoting as needed. So you weren't waiting for that renewal date to come up to start to show your worth and value.
We don't even look at renewal dates, to be honest. We just look at results, pivot, strategy, and different plans. So in one sentence, how would you describe your experience working with us so far?
That's been great. Great communication. I mean, between emails and weekly check-ins and being on having a Slack channel. No, it's great communication. Very pleased with that, so that we can make those adjustments and continue to grow.
Thank you for your time.